Thank you, Adam, and thanks again to all of you for joining us. As Adam mentioned, we will be taking some time today to provide you with updates on several board initiatives with a healthcare provider focus. Our agenda today includes updates on the expanded provider law, the board's new medical fee schedules, and the New York Workers' Compensation Drug Formulary. We'll also take a look at the board's New York Medical Treatment Guidelines and the progress of the Onboard initiative and what you as providers should be doing to prepare for the launch of Onboard Limited Release. Finally, we will discuss the board's transition to the CMS 1500 form and leave time at the end of the presentation for your questions. Let's get started with an update on the expanded provider law. As part of the 2019-2020 budget, a law was passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State Workers' Compensation System. The law allows more healthcare provider types to treat more injured workers. Since the expanded provider law was implemented on January 1st, 2020, an influx of more than 14,000 healthcare provider applications have been processed to date. Currently, the board processes up to 350 applications per month, 70 to 80% of which come from new expanded provider types. This includes having to investigate and deny up to 17 applications in some months. And the board is always on hand to help. We have responded to approximately 250 calls, emails, and letters each week, or about 13,000 per year. As a reminder, the board has developed an easy online application process to apply for authorization and authorization renewal. Healthcare providers and payers are encouraged to sign up for the board's medical portal, which allows you to submit medical information and view board information online. Now let's go over some updates regarding the New York State Workers' Compensation fee schedules. As you may be aware, one of the actions the board has taken to improve the workers' compensation system for providers and hopefully encourage more to participate is to implement new fee schedules with higher reimbursement rates for all provider types, as well as additional increases for certain specialty provider groups. Communications have been issued on the following: inpatient and outpatient fee schedules, workers' compensation enhanced ambulatory patient group fee schedules, the podiatry fee schedule, the dental fee schedule, the private psychiatric hospital fee schedule, the durable medical equipment fee schedule, and fees paid for out-of-state care. More information for each fee schedule is available on the provider section of the board's website at wcb.ny.gov. Next, we'll take a look at Ground Rule 17, the Designated Provider Enhancement Reimbursement. In an effort to increase the number of board-authorized providers in the primary care medicine specialties available to render care and treatment to injured workers, such as family medicine, general practice, and internal medicine, the board has established board-specific modifier 1D, which will provide a 20% reimbursement increase to providers with board-assigned rating codes and services. Under Ground Rule 18 is a behavioral health provider enhanced reimbursement. The board has established board-specific modifier 1B, which will provide a 20% reimbursement increase to providers with board-assigned rating codes for designated services. Please note, if you are a designated provider who has billed for services using the appropriate modifier and have not been paid, file a healthcare provider's request for decision on unpaid medical bills, or Form HP1. As you are probably already aware, the board has been actively developing a new and improved business information system called Onboard, which will offer stakeholders, including healthcare providers, a much easier and more efficient way of interacting with the board. It will replace our multiple legacy paper-based claim systems with a single web-based platform. While stakeholders will experience several major benefits with the new Onboard system, building a new integrative system from the ground up takes time. That's why we're starting with some high priority processes that will benefit from moving online. The initial release, Onboard Limited Release, will enable providers to submit prior authorization requests, or PARs, and requests for decisions on unpaid medical bills online. We will review this more in depth in the next slides. While we do not have a firm revised launch date to share at this time, the board is committed to providing the launch date at least 4 weeks previous to implementation, so stay tuned for that announcement. There are some things you can do now to prepare for onboard limited release. Healthcare providers must use the medical portal to access onboard limited release or to apply for or renew an authorization, which requires an ny.gov user ID and password for access. The updated medical portal section of the board's website contains full details and information on how to register and get an ny.gov user ID and password, and grant access to others to act as your delegate to access onboard limited release. If you are already accessing the medical portal, your credentials will provide you access to onboard limited release. Visit the link on the slide for a guide on registration. Assigning delegates, such as your office support staff now, will benefit you when onboard limited release launches, as delegates can assist you by drafting PARs, which must be reviewed and submitted by the healthcare provider, drafting escalations to level 2 medication PARs, which must be reviewed and submitted by the healthcare provider, drafting PAR escalations to level 3 for medical director's office review, responding to insurer requests for information, and drafting and submitting Form HP1. We would like to note, however, that delegates cannot do the following. They cannot register with an XML submission partner, they cannot register with the medical portal, and they cannot report on a provider status. For more information, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for healthcare providers. You can also view fact sheets and FAQs about onboard limited release for providers. For additional questions, email onboard@wcb.ny.gov. I would now like to go over some recent regulations that were adopted regarding the New York Workers' Compensation Drug Formulary. Legislation enacted in April 2017 requires the board to establish a drug formulary under which all prescriptions must comply. The formulary includes a list of preferred medications that can be prescribed to injured workers without any prior approval. In conjunction with onboard limited release, all new as well as refill prescriptions must comply. A renew or refill is a medication the patient has been currently taking or the same medication in a lower strength. Requests for non-formulary medications will need to go through the medical portal process. The board has also required that carriers provide prescribers with a list of their patients currently taking non-formulary medications. Carriers were required to notify patients taking non-formulary medications of the medications and instructed to talk to their providers. The drug formulary is based on a medication's effectiveness and appropriateness for the treatment of illnesses and injuries covered under the workers' compensation law. Regulations regarding the formulary that were adopted by the board and published in the September 1, 2021 State Register will be deferred from September 1, 2021, and will coincide with the launch of onboard limited release. Those regulations include the following: a new effective date for compliance with the formulary for refills and renewals, previously delayed due to the COVID-19 pandemic, to coincide with the launch of onboard limited release, and clarification that a medical marijuana PAR will no longer be submitted via the existing variance request process, but will instead be submitted with onboard limited release as a medication PAR, although the criteria needed for approval will remain the same. More information about the formulary can be found by visiting wcb.ny.gov. Select Providers at the top of the homepage, scroll down to Resources, and select Drug Formulary under the Treatment section. Another key area of focus for the board has been the New York Medical Treatment Guidelines, or MTGs. On October 13th, 2021, the following MTGs were posted for public comment: traumatic brain injuries, complex regional pain syndrome, and occupational eye disorders. The public comment period has closed for these MTGs, and the comments are being reviewed and processed. We anticipate these 3 new MTGs to be adopted early in 2022, along with the other new and updated MTGs to coincide with the launch of Onboard Limited Release. This will include some minor edits and clarifications to all 3 MTGs based on the public comments received, but there will be no major changes. You can access full details on the amendments, including a PDF of the respective MTGs, on the board's website at wcb.ny.gov. Select Providers at the top of the homepage, scroll down to Resources, and select Medical Treatment Guidelines under the Treatment section. You will also find links to MTG trainings currently available for medical and non-medical professionals. We encourage you to take those trainings so you are prepared when the revised MTGs become effective. We offer 2 versions, one that provides CME credits and a non-CME version for those who don't need CME credit. Trainings for newly adopted MTGs will be announced when they are available. We intend to have online trainings available for all MTGs well in advance of their effective date. To access these trainings, visit wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, select the training link on the right side of the page. And just a reminder about the availability of the MTG Lookup Tool in the medical portal. The MTG Lookup Tool allows users to quickly determine whether a particular condition or treatment or test combination is recommended, not recommended, or conditional according to the MTGs. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. The MTG Lookup Tool also has a feature for use by providers that provides a verification summary document that confirms a lookup was completed, provides treatment recommendations for that condition, and displays patient-specific case information. This document can be kept by the healthcare provider or attached to any request for service or medical bill being sent to an insurer as verification that the treatment adheres to the recommendations set forth in the MTGs. The MTG Lookup Tool is available for the following MTGs: elbow injuries, foot and ankle injuries, hip and groin injuries, hand, wrist, and forearm injuries, including carpal tunnel syndrome, occupational interstitial lung disease, occupational work-related asthma, post-traumatic stress disorder, and major depressive disorder. To access the medical portal and the lookup tool, visit the board's website at wcb.ny.gov and select Medical Portal from the Online Services menu at the top of the homepage. Next, we'll take a look at the board's transition to the CMS 1500 form. To reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form, which is the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services as well as health insurers. Beginning July 1st, 2022, providers must submit the CMS 1500 form. Electronic submission through an XML submission partner is strongly encouraged, although not required. When mandatory submission of the CMS 1500 form begins, use of current medical billing reports, including Form C4 and Form C4.2, will be discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. If you come across payers who are not complying with the CMS 1500 initiative requirements, please email cms1500@wcb.ny.gov. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies provider submissions of the CMS 1500 form. The template includes the 3 mandatory elements to include with most narratives: the patient's work status, causal relationship of the injury to the patient's work activities, and temporary impairment percentage. A medical narrative report may be found legally defective if these elements are missing. Please note the CMS 1500 initiative does not change anything related to a payer's assessment of causal relationship. It merely requires causal relationship to be reported prominently in the medical narrative. A PDF of the report can be found at the link on the slide under the medical narrative requirements section. When the medical narrative template is used, providers must attach a narrative report with examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and the plan of care. Healthcare providers are encouraged to sign up for the medical portal now so you may take advantage of all the online services the board offers, including registering for electronic submission of medical bills to payers and the board. Once you are registered for electronic submission, you can then discuss details of submission with an improved XML submission partner, also known as a clearinghouse. After logging into the medical portal, providers who have not already signed up for XML submission of the CMS 1500 form will see a link for Agreement for XML Submission of CMS 1500 under the Billing section. Select the link and select the I Accept button. The provider's name will be added to the listing of providers authorized to submit XML data, which is updated daily. Once accepted, the link will no longer appear when you sign in again. For more information, visit wcb.ny.gov/CMS1500, select XML submission partners on the right side of the screen, and then select registration for XML form submission. We have received a number of questions about submitting the CMS 1500 form electronically. Here are a couple things you need to know as we make the transition from paper to electronic submissions. As mentioned earlier, electronic submission of medical bills by providers through an XML submission partner will be strongly encouraged, but not required. When providers submit CMS 1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the carrier and the board. As a reminder, the following forms will soon be discontinued: Form C4, Form C4.2, Form EC4-NAIR, Form OTPT4, Form PS4. With these forms being discontinued and CMS 1500 form being adopted, it makes sense now to switch over to electronic submission. And I'd like to take a minute to highlight the many benefits of electronic submission. Providers will have confirmation within 7 days that their bill was accepted or rejected by the payer. Providers typically get paid quicker. With acknowledgement of receipt from the payer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the payer to deny the bill. For more information, visit wcb.ny.gov/CMS1500 or email cms1500@wcb.ny.gov. Additionally, we will soon be hosting 2 CMS 1500 Q&A webinars specifically for providers, so be on the lookout for that email notification. Finally, we have a quick update on the board's telehealth policy, which was implemented on an emergency basis at the start of the COVID-19 pandemic. Emergency telehealth regulations have been in place since March 16, 2020, to allow telemedicine in some circumstances for social distancing purposes due to COVID-19. The most recent telemedicine emergency adoption was filed on January 11, 2022. A notice of emergency adoption will be published in the January 26, 2022 edition of the State Register. Permanent telehealth regulations were proposed on July 14, 2021. Having reviewed the public comments, the board plans to file a revised proposal soon. Once that revised proposal is published, a new public comment period will commence. You can submit comments to regulations@wcb.ny.gov. As we continue to work on implementing improvements for healthcare providers, we're committed to increased communications with providers, such as this webinar and targeted email. The board has also created a special webpage dedicated to sharing timely updates on various board initiatives with a healthcare provider focus. Visit the board's website at wcb.ny.gov and select the Provider Updates quick link on the provider page. We're also committed to regular engagement regarding onboard. As primary users of the new system, your input and engagement in the project is very important. We will continue to hold onboard-related webinars and trainings. We want you to help champion the system as it rolls out. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You can choose the topics you'd like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. If you have provider-specific questions, you can call the helpline at 518-486-3331 or email Medical Director's Office at wcb.ny.gov. Thank you for attending this presentation on important updates for healthcare providers.